Hi, it's Halie and Grace coming to you with an MDA legislative update. Session began earlier this month, and after a big election cycle, here's a few things to note. Missouri swore in 64 legislators, as well as a new governor, Mike Kehoe, along with a state treasurer, state lieutenant governor, and secretary of state, and an attorney general. The Missouri Senate and House of Reps also elected new leadership, including the first female president pro tem of the Senate in state history, Senator Cindy O'Loughlin, and the House elected Speaker Representative John Patterson as their new Speaker of the House.
We've got one piece of legislation that MDA is sponsoring this year, dental loss ratio. While we haven't secured a Senate sponsor yet, Representative Kit Hayden has filed House Bill 439 that would establish an 85% dental loss ratio in Missouri. We filed this last year, but due to the incredibly volatile environment in the 2024 legislature, we saw little progress. But we are looking forward to making more progress this year and continuing our discussions like last year.
We're also looking to get some important dental appropriations items across the finish line this year, including maintained funding for Medicaid and donated dental services, and increases for Medicaid anesthesia rates and the Elks Mobile Dental Services.
The Oral Preventative Assisted Pilot Project was officially promulgated in rule, and the cohorts began their clinical training December 1st. This means data collection has begun, and we are excited to see how this not only alleviates workforce shortages, but also improves oral health in Missouri.
We are in a great collaboration with the Missouri Coalition of Oral Health and Missouri HealthNet to continue important work being done on the Missouri dental Medicaid front. Thanks to this collaboration, a major Missouri managed care organization has decided to reverse its policy on multi-surface restoration downcoding. Wins like this happen behind the scenes, just like they happen in the legislature, and they deserve to be celebrated. With session starting, this also means that registration is open for Dental Day at the Capitol on March 5th, 2025. This is a great opportunity for you to come meet your legislators and talk about all the issues that you are facing in dentistry. They rely on you as constituents to provide firsthand experience. We'll also share a link to register.
It's also important to note that now is a great time to invest in your profession and donate to Mo Dent PAC today. The MDA has an incredible reputation, and this does not happen without strong connections to legislators and a well-funded PAC. We are thankful for those who have given to the PAC and for this significant increase in PAC givings in the last year.
As always, feel free to reach out to our advocacy team with any questions, and we'll see you on March 5th for Dental Day at the Capitol. Don't forget to register.
Halie and Grace gave you a great idea what's going on legislatively in 2025 for the MDA. I wanted to dive in a little bit more on the workforce challenges that our dentists are facing. And we continue to hear from the ADA's Health Policy Institute as they survey nationwide that staffing shortages are certainly one of the top challenges for practices. Even in the most recent Q4 2024, 90.1% of respondents to the survey showed that recruitment of hygienists was extremely challenging. Now, one positive thing is that the most recent data is showing that hygiene class sizes are increasing from graduate programs in 2024. So MDA certainly is grateful to hear about that. Yet it also continues to show that hygienists retiring or leaving the market is still not balancing out what's needed, obviously, for the dental offices across the country. MDA has been a strong supporter of increasing dental hygiene numbers and scope. Most recently, we supported that hygienists in the state of Missouri would provide local anesthesia under general supervision. So that's a positive thing for advancing scopes for hygienists. We also have been in support of the nursing home project, and that's whereby a hygienist can go into the nursing homes, deliver some temporization of care, provide some telehealth services, and then be able to get those patients to the dentist where they can be seen. So that's a very positive thing. We know our dentists are experiencing staffing shortages as well. We hear weekly that they are having a hard time not only finding hygienists, but really finding people even to interview. So obviously hiring in dental offices still continues to be a huge issue. We probably get 1 to 2 calls a week about the oral preventative assistant. and people wanting to be able to hire that individual within their office. And I will tell you that, as we've stated before, this is a pilot project. It did commence in December of 2024. There are several sites that are able to provide services through the oral preventative assistant, and they are working hard to gather the data and provide the care in order to bring this to all providers in the state of Missouri. However, that is a pilot project. I can assure you, I'll say that again, that we are working very hard to bring that into existence across the state. Not only has it been seen as a value to Missouri, but nationally the ADA is very much in support of that, as well as the American Legislative Exchange Council. That council, which is made up of a conservative group of legislators and others, they are bringing that model across the country. And ALEC adopted a model into their dental health care workforce policy. So they approve the fact that not only expanded function dental assistants are very important, but also that the OPA should be something that's in existence in the dental workforce nationwide. So Missouri is certainly advancing models that will assist with care delivery. We hear what is needed. We know you are waiting patiently. And I can assure you again that we are doing our best to progress through these areas and bring these workforce initiatives to you so we can help you. We certainly thank all the dentists that have dug their heels in, that have helped to create the OPA and move this project along. We now need you to advocate for this. We will need this now. We will need this in the future. We want you to support our PAC so we will be able to bring this to the state of Missouri. Our power to drive change, it comes from you all. It comes from our dedicated members and dental professionals. So let's keep fighting and winning for dental practices and professionals and Missourians.